I am Liliana Cote de Bejarano, and I will be your host for this section of the One More Soul Healing After Contraception Retreat. Today, I am very pleased to introduce Dr. Angela Lanfranchi. Dr. Angela Lanfranchi is a breast cancer surgeon who practiced in New Jersey from 1984 to 2017. She graduated from Georgetown School of Medicine in 1975. She's a clinical assistant professor of surgery at Rogers Robert Wood Johnson Medical School, a fellow of the American College of Surgeons, and certified by the American Board of Surgery. She was surgical co-director of the Sanofi Breast Care Cancer in Somerville, New Jersey for 10 years. She is the co-founder and president of the Breast Cancer Prevention Institute, a nonprofit charitable corporation that has as its mission to educate lay and professional communities in the methods of risk reduction and prevention of breast cancer through research, publication, and lectures. She is the published author of articles on physiology and epidemiology of abortion, breast cancer, and hormonal contraceptive risk, and informed consent. In her work with the Breast Cancer Prevention Institute over the past 25 years, she has traveled nationally and internationally, speaking at medical schools, hospitals, universities, cancer organizations, local and national governments, and the United Nations about breast cancer risk, included its association with abortion and hormonal contraception. So thank you, Dr. Angela. Thank you very much for taking the time to speak today with us about hormonal contraception and its impact on body, brain, and behavior.
It's good to be here. So you can give me the next slide.
Yes.
So I wrote this little book on health hormones and contraceptives. And you can get the contraceptives into your body by orally, like the pill or the mini pill. You can get an injection like the depot shot. You can insert it into the vagina with the vaginal ring or into the uterus itself with an IUD. The Mirena IUD is one. You can put it on your skin in the patch and it'll get absorbed, or it can be implanted in the subcutaneous tissue in the form of rods. So no matter how you choose to get it into your body, it doesn't matter. It's in there and it's going to have an effect. So there are two main drug formulations that most people use, which is the pill, which is a combination of estrogen and a synthetic progesterone known as a progestin. There's also a progestin-only mini pill, as well as the Depo-Provera shot, which is only progesterone. So if you say what parts of your body are affected by hormonal contraception, you can see that there are estrogen and progesterone cellular receptors throughout our entire body. So you see on that little chart how it affects our heart and cardiovascular system, which is why you can have an increased risk of heart attacks or blood clots. It affects our liver, which is why you can get hepatocellular adenomas of the liver from birth control pills. It, of course, affects our breasts. It enlarges them and stimulates them. So there are many effects based upon how many of where you have estrogen and progesterone receptors. But one part people don't usually think about is the brain. Next. So it's not only ovaries and uterus, but brains, breastbone, liver, heart, blood vessels, even your digestive tract, your bladder, and your skin. It affects our immune system. And it's all because of these receptors that are throughout our entire body. Next. So we asked the FDA to change the package inserts that they give women who buy, these drugs. And they actually responded to us and changed the warnings in regards to breast cancer. But there were 9 other areas we were asking them to change, and they said that they're still reviewing the data. You can get that entire FDA petition with all the documentation of these ills in that health, hormones, and contraception booklet, or you can get it at the FDA website. Next. So these are all the diseases that are affected or associated with the hormonal contraceptives. So there's a list of how many extra cases are there of these diseases, and treating them, how much do they cost? So you increase the risk of HIV because it increases your ability to transmit it and receive it. Breast cancer, cervical cancer, Crohn's disease, ulcerative colitis, systemic lupus, psychological depression, fractures, cystitis, myocardial infarction, stroke. Now, sometimes the hormonal contraceptives will reduce the incidence of a disease like hyperthyroidism, uterine and ovarian cancer. So even if you were to take those cases out of that list, which we did, there are over 1 million excess cases of people with these diseases, and treating them costs $16.8 billion a year in the United States. Next. So why does it affect our brain? Well, you can see by this diagram how many estrogen and progesterone receptors there are. And in the center of the brain are these organs that really affect our moods and behaviors, and therefore our relationships. Next. So that important central part is the limbic system that affects how we behave and our emotional responses. So those are the amygdala, the hypothalamus, which regulates our menstrual cycles, libido, appetite, sleep, and the hypothalamus, which connects our endocrine hormonal system to the nervous system. And then, just to make things a little bit more complicated, there are alpha and beta estrogen receptors. So there are certain receptors that, if they're affected, are different, cause different effects. Next. So in medicine, we assign a number to every disease there is. It's called the ICD codes. So if somebody comes into your office, they have to leave with an ICD code. So there were these 2 large cohort studies that linked hormonal contraception to violent death. And violent death is considered homicide, suicide, or accident. And there's codes for each one of those. In the US, 1/3 of all female homicides are by an intimate partner. 30% of all emergency room visits by women are due to trauma inflicted by an intimate partner. Homicide is the leading cause of death of pregnant women. And you can see by those CDC data from 2017, 1 to 19, there's 10% dying of suicide, 7% homicide, 20 to 24, 7% suicide, 3.8% homicide. So it's a significant cause of death. Next. So this is the study from Britain, where they have a database of the Royal College of General Practitioners of everybody who's taking oral contraception. They had over 46,000 women in this study. And when they were looking at the difference in death rates and what was causing the death rates between two groups of women, women on contraception, hormonal contraception, and women that weren't taking hormonal contraception, they found that everything was equal between the two groups, except women taking oral contraceptives had higher rates of violent death. And not only that, it was statistically significant, meaning that it couldn't have been done by chance alone with 95% certainty. And there was a dose effect. The longer the women were on oral contraceptives, the higher their risk of death. So that was put out in 2010. Next. So what they said in their paper was, we are unable to explain the increased risk of violent and accidental deaths in our study. But it was there. In fact, it was 192% increased risk of violent death among the pill users. Next. So they have something called rapid responses, which is basically a letter to the editor online. And immediately, the day after it came out, there was someone called S. Craig Roberts, who is a researcher. And he said, Hannaford said they didn't know why. But I think I may know why. And it has to do with our evolutionary psychology. Next. So if odor, pheromones, play a role in human mate choice, our results suggest that the contraceptive pill disrupts these mate preferences. Next. Oral contraception alters women's preferences for men such that pill users prefer men who are similar to themselves. And the women off the pill want somebody who's more genetically different in their MHC genes. One consequence of being partnered with similar men is lower sexual responsivity. They reject sexual advances more frequently, and they more frequently have extra pair partners, meaning infidelity, when they're on the pill, when they've chosen their mate on the pill. Next. So he felt that those changes in behavior of rejecting sex more frequently and being less responsive could be the thing that increases the risk of intimate partner violence. You know, it's very common. Infidelity causes a violent reaction. So that they felt was the most common cause, and it counts for more than a third of the women murdered in the United States. So he felt that was very significant. Next. So, and he knew that because a couple of years before, he had published this paper in the Proceedings of the Royal Society, which showed that MHC, major histocompatibility, correlated odor preferences in human and the use of oral contraceptives. And this is important because the MHC genes regulate how we respond immunologically. So the more different genes you have, by picking a more dissimilar man than you in these genes, means you have a wider range of ability to kill pathogens like bacteria or viruses or parasites, and that increases your ability of your infants to survive. So it's a very important. And conversely, when women are pregnant and when they're on oral contraceptives, they're in a pseudo-pregnancy state. When women are pregnant, they want to be around men that are more similar, their family, to protect them. So this all made good evolutionary sense. Next. So in 4 years later, there was a study done on over 121,000 American women. In the nurses' health study, there's a group of nurses that they collect data on for, over 30 years. And they looked at to see if they could replicate or they would have the same results. And they did find similar results in American women. Violent or accidental deaths were more common among ever users of hormonal contraception. Again, statistically significant. Most of the deaths were driven by suicide. That actually gave you a 40% increased risk of suicide. So they found the same thing. Next. But they wanted to downplay it. They said, however, it's unlikely this is a causal association given a lack of biological mechanism. So that always intrigued me. What would be the biological mechanism of this happening? Next. Well, that came out a few years later in 2018, when Skovland published a study in the American Journal of Psychiatry, and it was on Dutch women. And what they found was there's an increased risk of depression and suicide among women who had taken oral contraceptives. And not only that, the effects were present after only 2 months of usage. And what I also found interesting in analyzing the paper was that the higher the concentration of estrogen in the formulation of hormonal contraceptives, because they included all of them, the patch, the pill, the mini pill, it was the higher the estrogen, the higher the risk. So that compared with women who never used hormonal contraceptives, the relative risk for suicide went up over 200%. Next. So there's an association of hormonal contraception with suicide attempts and suicides. Overall, of all formulations, there was a 97% increased risk, but look at the patch. The patch had over 200% increased risk. Now, why would that be? Because both the vaginal ring and the patch introduce the estrogen through our systemic circulation. So it's not like a pill that you ingest that gets metabolized through the liver before other effects are gotten through the systemic circulation. Next. Now, it always bothered me that you got an effect after 2 months. And always stuck in my head, how could it happen in just 2 months, a short period of time? So next. Well, oh, I'm sorry, go back. What Lanfranchi found in her 2016 study was that when she looked with an MRI of women's brains before and 3 months after they started on hormonal contraception, she found that there were actually structural brain changes. Next. So I was intrigued by all of this. So this is a paper that I wrote that's available on our website and online for free, Hormonal Contraception and Violent Deaths. And it's published in Frontiers in Behavioral Neuroscience. Next. So in that paper that I wrote, I talked about this review article that looked at 33 different articles in the literature at that point in time, which was 2020, that found 10 structural changes in the brain. The structure of their brain had changed, and 23 functional ones. And in those changes were in the affective, meaning emotional, and cognitive processing, which I talked about before, your amygdala, your hippocampus, your prefrontal cortex. Next. So these were some of her findings. Oral contraceptives enhance fear, increasing anxiety, enhanced fear learning. Hormonal contraception interfered with oxytocin. Now, oxytocin is that binding hormone that's released when you're breastfeeding. It makes you feel closer. It's also found when you have sexual relations with your partner. Your oxytocin increases, and you feel more bonded to that person. So it affects how attractive you find your partner, which may be why, the women on oral contraceptives were less sexually responsive to their partner. And if you started hormonal contraception in adolescence, in teenagers, which is often done in the United States, they had long-term increase in major affective depressive disorders, the kind that result in hospitalizations and suicides. And that persisted even after they stopped taking them. Next. Other facts. Depressed individuals had smaller left amygdala than never depressed. So your amygdala, when you have a smaller amygdala, that's associated with depression. And women taking hormonal contraceptives had smaller left amygdala compared to naturally cycling women when they did these MRIs on their brain. Patients with bipolar disorders had decreased volume of their amygdala and increased response to emotional stimuli. So an increased startle response. How jumpy someone is, how anxious they are, how worried they are. Next. So there's also a very important part of your brain, which is the hypothalamus, because it connects the hormone, it regulates like an orchestra conductor all these hormones that are passing through your body. And what they found was women on oral contraceptives had a smaller hypothalamus, a statistically significant decrease in the volume of the hypothalamus. in women on the pill. And they also, when they gave them a questionnaire, a survey, they also had more depression and anger. And that can be associated with that increased fear and like that. Next. Now, there's also a disorder called borderline personality disorder. It's actually one of the most common disorders there are in psychiatry. In the United States, there are over 4 million women that have been diagnosed with borderline personality disorder. So what's really bad is that you have 9 million women on the pill, and some of them are going to have borderline personality disorder, which is characterized by unstable, intense relationships, impulsive and risky behaviors like drug abuse, unsafe sex, reckless driving, suicidal threats, self-injury, wide mood swings, loss of temper, and physical fights. And in women who have borderline personality disorder that are not on the pill, their symptoms vary with their menstrual cycle. So you can see that the pill has disrupted the menstrual cycle. So all of their symptoms worsen. Next. So other findings are that both women and men in the relationship with these women feel increased jealousy when the woman's taking the pill. And that drives mate retention behaviors. So good mate retention behaviors where the man is trying to keep the relationship going. Good ones are, I take you out to dinner, I buy you flowers. But some of them lead to intimate partner violence. Again, the jealousy increases with increased estrogen in the formulation. And that was found in 2 different studies, one in 2001 and one in 2012. So then the women have more extra pair bondings and fidelity, which leads to intimate partner violence. And then because they're on hormonal contraception, they don't feel the same oxytocin levels. And so they don't have as strong pair bonding. Because women taking hormonal contraception lose the normal response to oxytocin. So when they get oxytocin, they are not responding to it the same way, and they don't perceive their own partner as attractive. Next. One area that we never talk about, it seems, is that if women are on the pill and you say, how reliable is the pill? Well, they're really thinking it's 100% reliable, because if someone's taking the pill and the woman gets pregnant, the boyfriend always thinks, you tricked me. You stopped taking the pill because you wanted to get pregnant. But in actuality, for the pill, the CDC reports a 9% failure rate. So in this particular formulation of hormonal contraceptives, in this country, there's 6.4 million women using the pill, estrogen and progesterone combination drug, which means with a 9% failure rate, over 500,000 women are going to have, quote, unplanned pregnancies a year. And according to the Guttmacher Institute, about half of them will choose to have an abortion, which is like over almost 250,000 a year just because the pill failed. Next. So abortion is not good for women either. So Priscilla Coleman did a meta-analysis of all the studies of the adverse mental health outcomes after abortion. And what she found was there was a 34% increased risk of suicide, a 20% increased risk of suicidal behaviors, and an 8% increased risk in depression, an increased risk of alcohol and marijuana substance abuse. And we all know if people are having substance abuse, they can make mistakes and actually have an overdose. Next. And what about the children? So if you've taken, there's a certain amount of women who are taking the pill faithfully and still get pregnant. And what if you conceive and you're on the pill, there's an association with, if you've taken it within 30 days of conception, of hormonal contraception and autism. So there was a experimental study in China where there was prenatal exposure to levonorgestrel, which is what is in the Mirena IUD. And that caused autism-like behavior in rats when they suppressed the estrogen beta receptor. Progestin, it was commonly used to prevent threatened abortion. At the time of conception, if you had estrogen, progestin contaminated seafood, you increase the risk of autism in children. So if you have bleeding during pregnancy and you want to make sure you don't go on to miscarry, they'll give you some progestin. But that was found to be, it resulted in increased risk of autism in children. Next. Now, in 1999, Gisler did a study using vital statistics in Finland. Now, Finland is a relatively small country. And what she did is she looked at death rates of women between 15 and 49 years old. And what she found was that within a year of an induced abortion, there was a significantly increased risk of homicide, over 300%, suicide, over 200%, and accidents. So then later on, not that long ago, she did another study that said, look, we're losing these women to suicide after abortion. So let's screen these women for depression when they come in for a checkup after their abortion. And when they did that, they decreased the risk of suicide by 30%. So she saved women's lives by doing that. Next. Now, what's interesting is there's a deep physiologic, biologic basis of this. There was a study done by Camilleri in 2019 where they took lab rats and they knew what their behaviors were, how they interacted with other rats and how often they got on the treadmill and, how they nested and took care of themselves and groomed. And then they took, after they had the baseline of how they acted, they aborted the rats that got pregnant. And after that abortion, the rats had a reduction in grooming, a reduction in exploratory behavior. They would just sit around, they were immobile, and they became subfertile. So those rats weren't having, discussions about abortions, interaction. I mean, there was a physiologic basis that changed when they got that abortion that changed their behavior. Next. So, in summary, there's more violent death with hormonal contraception. There's homicide, maybe due to the unplanned pregnancy, due to failure rate and intimate partner violence. Sometimes if the woman won't get an abortion, the partner kills her. Intimate partner violence also increases due to stress in the relationship because there's infidelity of extra pair bonding, an increased risk in jealousy, subfertility, sick children, and the abortion also increases the risk of preterm birth, autism, and in general, those children are sicker. They gave mothers questionnaires. And, how much school does your child miss because of illness? Do you regard your child as having robust health, or is he more sickly or whatever? There's also an increased risk of suicide with increased depression, or due to making somebody with borderline personality disorder worse, where they're taking even riskier behaviors and killing themselves or having accidents. Accidents increase after abortion, and it also worsens the borderline personality symptoms of risk-taking and drug abuse. Next. So in order to save women's lives, we should be screening women before they're ever given the pill for depression, borderline personality disorder, seeing if their partners, if there's any intimate partner violence, because it's going to get worse when they get on the pill. You should also give them informed consent. You should tell them there's a 9% failure rate with this formulation or a 6% failure rate. What are you going to do if you get pregnant? And if you choose abortion, you'll get worse for all the other reasons abortion is unhealthy. So for informed consent, you have to give them a failure rate. You have to say, you may become suicidal or depressed. There'll be social behavioral changes like the increased jealousy, and you will have significant health risks like blood clots, breast, cervical cancer, ulcerative colitis, and all the other diseases that I showed in that chart. Next. So this is the final thing I'm going to say to you. In 1972, which is about 10 years after the introduction of the pill, Lionel Tiger was a professor of anthropology at Rutgers University. And he wrote this book about how much he saw male-female relationships change after the pill was introduced. Next. And in that book, he gave the example of what happened with an experiment on a macaque troop, which are monkeys, off the island of Bermuda. So the island is small and the scientists can get to them. And what they looked at was what would be the effect of Depo-Provera injections in the females. Next. So there were 3 stages. One is they looked at the animals, how they interacted with each other before anybody got Depo-Provera. There was an alpha monkey who had alpha male who had 3 consorts, that kind of thing. And then they looked at after the observation of 3 months, what would happen with the 5 females that they captured and injected with Depo-Provera? And this is what they found. Next. The alpha male had 3 females that he had sex with and groomed. And it just so happened that 2 of the 5 females that they caught and gave the shots to were his. So he still groomed them, but he no longer had sex with them. And he replaced those 2 with 2 that didn't have the Depo shot. Next. And then in the third part of the experiment, when all of the females of the troop were injected with Depo-Provera, it caused the alpha male to attempt to rape, masturbate, and behave in a turbulent and confused manner. So if you have a significant percentage of the population that men are interacting with on these drugs, you could probably expect maybe some of the same problems to occur. Next. The end.
Okay, excellent. Thank you very much, Dr. Angela, for being with us today. That's awesome. Giving us this wonderful talk about the hormonal contraception and this awful impact on the brain, structure, functional, behavioral. Hormonal contraceptives have been on the market for more than 50 years. The formulations have changed, but the basic mechanism of action is the same. Thank you so much for illustrating all these well-documented effects that we usually don't hear about. We hope many can benefit from this knowledge and find healing from serious impacts of the contraceptives on behavioral and mental health. Dr. Angela, thank you so much again. I pray that your work with the Breast Cancer Prevention Institute grows deeper, expands everywhere, and may God bless you.
Thank you.